Hi, this is Logan Myers,
And this is Victoria Mathew.
and for our presentation, we researched glioblastomas.
For the presentation of David H's clinical case, he presented symptoms of drowsiness and progressive hemiparesis, which is the muscle weakness or partial paralysis on one side of the body that can affect the arms, legs, and facial muscles. When David was in his early 30s, he presented symptoms of a low-grade astrocytoma of the right temporal lobe. And 3 years after the surgery, his follow-up scans showed that a tumor was present once again, and unfortunately, it was a glioblastoma. As for the demographics of glioblastomas, they're slightly more common in men than women, according to the American Brain Tumor Association, and 2 times higher in Caucasians compared to Africans and Afro-Americans, with lower incidence in Asians and American Indians. Unfortunately, the prognosis is very poor, and with standard treatment, median survival for adults with glioblastoma is approximately 11 to 15 months.
Glioblastomas affect the nervous tissue, more specifically astrocytes. Astrocytes are neuroglial cells in the central nervous system. Astrocytes attach themselves to the synapses of neurons in the surrounding capillaries to keep the nervous tissue anchored and connected to their primary source of nutrients. Astrocytes are called such because of their shape. They kind of look like stars. They're found all throughout gray matter, and that means that brain and spinal cord tissue are affected. Glioblastomas are found mainly in the cerebral hemispheres, but as mentioned before, can be seen all throughout the brain and spinal cord, wherever astrocytes are present. A study by the National Center for Biotechnology Institute broke down the lobes by percentage of clinical appearance. Glioblastomas, 40% of the time, present themselves within the frontal lobe, 29% in the temporal, 14% in parietal, followed by 3% in the occipital lobe. The rest of the percentages obviously show up in the rest of the brain and spinal cord. Treatment-wise, there is surgical removal options, which do carry their own risks. Radiation therapy and chemotherapy are some of the most successful options, but do have associated nauseating effects on the patient. Tumor treating fields are electrical fields that are focused at a certain frequency to prevent the mitosis of tumor cells, and palliative care to prevent and treat some of the pain associated with the disease.
As for the resolution of the clinical case presented in Henry Marsh's book, Do No Harm, David H. unfortunately did not survive after suffering from a glioblastoma. This also matches the information presented in the first few slides regarding prognosis and demographics, as he was a male and also had a very small chance of surviving. 3 things that the group learned and are also curious about is whether there is any research or progress being made in improving the prognosis of glioblastomas, if there are any environmental factors that cause glioblastomas, and we also learned and were surprised that glioblastomas are not restricted to the brain, and that spinal cord and gray matter in general are host to glioblastoma development.